Hello and welcome to this presentation on net zero and primary care, how to decarbonise and how to develop a roadmap. I'm Dr. Matt Sawyer. I work as a GP and have done so for the last 15 years. I've also studied environmental science at university up to master's level. I concurrently run a sustainability consultancy providing carbon literacy training, carbon footprinting of primary care premises and help provide decarbonisation plans for practices. When considering the carbon emissions from primary care and the health service and the impact that we are having on the planet, what would be the prize if we became carbon literate and took action to reduce our carbon footprint and ended up at net zero? Nationally, in the UK, we have between 500 and 600,000 deaths each year. The Lancet has calculated that over 125,000 of these, or 25% of the total, of these wasted lives could be prevented if we met our pledged commitments to the international climate goals. That is, by 2040, we could be saving 98,000 lives through better flexitarian diets, 21,500 lives by people taking more exercise, and 3,500 lives from reductions in air pollution. What's good for human health is good for planetary health. The total carbon emissions from the health service is in the region of 25 million tonnes each year. Primary care is responsible for over 20% of that, at about 5.75 million tonnes. For primary care, carbon emissions can be split into clinical and non-clinical sources. For the NHS to reach net zero overall, each part needs to reach zero. Non-clinical carbon covers the running of the practices, and we will see more detail shortly. For clinical carbon in primary care, 13% of the total is due to propellants from inhalers and nearly 50% from pharmaceuticals and medication. In primary care, we need to recognise that these are our emissions and our responsibility. We need to have a plan which covers clinical and non-clinical carbon reduction. To reach overall net zero, all constituent parts also need to reach zero. A new report by Healthcare Without Harm on the global roadmap for healthcare decarbonisation puts forward a number of actions. 3 key actions include developing a roadmap, making zero emission commitments and declaring a climate emergency. But what does this mean for primary care in the UK? We already have greener NHS as a world leader in signalling the intent of the NHS to become net zero by 2045, but has this translated into action by primary care, such as CCGs, PCNs or individual practices? The Healthcare Without Harm report also highlights 7 high-impact actions that we can take. Firstly, we need to ensure primary care uses only 100% green, clean, renewable electricity. Secondly, by investing in zero-emission buildings, we need to ensure that every healthcare building promotes energy efficiency, zero emissions and climate resilience. Thirdly, we need to transition to zero-emission sustainable travel and transport. For me, this is not swapping from petrol and diesel vehicles to electric vehicles, but enabling the infrastructure needed for more active travel and public transport for all patients and staff as a default. Fourthly, as the Lancet has pointed out, there are many health and planetary gains from a more flexitarian diet that provides healthy, sustainably grown, seasonal food. Fifthly, we need to incentivise and produce low-carbon pharmaceuticals, reduce unnecessary pharmaceutical use, and substitute high-emission products with the more climate-friendly alternatives. Sixthly, we need to implement circular economy principles during our procurement, deploy clean technologies, and reduce the volume and toxicity of healthcare waste. And finally, we can reduce emissions by improving system effectiveness, including eliminating inefficient and unnecessary practices, and linking carbon reduction and quality of care whilst boosting resilience. So we can start to see some of the actions that we need in primary care. We can keep calm and make a roadmap. However, I don't think we have time to dawdle over this. We need to do something pretty quick to change the world for the better. As part of a roadmap for primary care, there are 4 things that we can do today for both practice or groups of practices such as PCNs or at wider CCG level. Firstly, we need clinicians and managers to become climate aware with carbon literacy training. Secondly, we need to know our numbers and have carbon footprints of our practices calculated. Thirdly, we need to develop a pathway to net zero for our practice. And finally, we need to make public declarations of a climate emergency. Becoming carbon literate is the first step. The Carbon Literacy Project defines carbon literacy as having an awareness of the carbon dioxide costs and impacts of everyday activities and the ability and motivation to reduce emissions on an individual, community or organisational basis. At the time of recording, 18,000 UK individuals has passed this training so far. There are a number of resources already available for primary care to improve their carbon literacy, some of which are listed here. Secondly, we need to know where the carbon hotspots in primary care are. We know there are clinical and non-clinical contributors to the total emissions footprint. This chart is the result of some recent work undertaken with a number of practices in the North West. The chart shows the breakdown of the non-clinical contributors. There are 5 main hotspots: energy use in practice, travel of staff and travel of patients, business services, and procurement of office and medical equipment and consumables. We can use the information gained from the carbon footprinting to put together a practice green action plan. If we're going to reach net zero, each contributing part needs to reach zero too. This is an example of some of the actions a practice can undertake in their plan to address each of the hotspots. The practices need to formulate their own plan to address each of the hotspots, and a practical guide is available on the Sea Sustainability website. In some areas, practices need to access some additional support and expertise, for example in carbon literacy training or energy audits. The latter can identify waste and help formulate plans to reduce energy use by 50%. There are staff employed within the health system, such as energy managers, which have a huge amount of expertise which can be translated into help for individual practices. Similarly, for sustainable travel officers, for travel plans for patients and staff. Some of these plans will need dedicated time to help primary care overcome the problems that they face. Procurement of medical and office equipment could lead to the development of a national green procurement guide, where the products used by primary care have already had their carbon emissions independently verified. Clinically, the Lancet identifies 2 carbon hotspots in primary care: MDI inhalers, which contribute 13% of the total footprint, and the rest of pharmaceutical and other chemicals, which is a further 48% of total emissions. As inhalers and respiratory care is a big contributor to the total emissions from primary care, this is an example of how the Sustainable Healthcare Coalition calculator could be used. It is part of some research which is going on to examine the whole respiratory care pathway. This focuses on salbutamol overuse. This is a big problem for both poorer patient outcomes and higher carbon emissions. Patients who have more than 3 salbutamol inhalers issued each year doubles the risk of an exacerbation. Around half of all patients fall into this higher use category, which increases their disease risk, increases their emissions footprint, and increases their exacerbation risk. In this case, better care translates into improved outcomes by reducing exacerbations, but also a lower carbon footprint. Alternatively, this pathway could look at maintenance therapy. Inadequate control, poor technique, or using MDIs rather than DPIs all raise the emissions footprint. Poor control is bad for the patients, bad for society, and bad for the planet. Finally, we need to be declaring a climate emergency, and a number of practices across the country have already done this. In primary care, a guide is available on the Sea Sustainability website, which helps practices, PCNs and CCGs make the carbon reduction work that they've been doing public and helps inspire the wider society to take the climate crisis seriously. But what does this mean? It means telling the truth and acknowledging that this is an emergency, acting now to take radical steps to halt biodiversity loss and reduce greenhouse gas emissions to zero as fast as practically possible, and to work together as we are stronger working with others to create new solutions. Increasingly, we are aware that the climate crisis is a health crisis. The pathway for primary care to become net zero has these 4 steps: to become carbon literate, to measure your carbon footprint, to have a practice decarbonisation plan, and to declare a climate emergency. Thank you for your time. I'm Dr. Matt Sawyer. These are my contact details, and I hope to see you again soon. Bye for now.